One propaganda I'm never falling for is that women don't support women. Yeah, I know the words in the street. I know what's going on. However, I feel like these conversations are just a setup. The more we hear this, the more we internalize it, and the more we are forced to enact it. But that's not the reality. Reminders like this conversation will help you understand that women have been their own greatest allies. Sexual and reproductive health care is one very good example where you see how women have continually held the line for other women, sometimes at great personal cost. Think about Henrietta Lacks, a black woman who walked into a US hospital in 1951, I think, with cervical cancer, and she never walked out. Now, what happened? The doctors took her tumor cells without her consent. And those cells became what we now know as the famous HeLa cells, became the very first immortal human cell line. And they helped prove that HPV causes cervical cancer, and of course it paved the way for HPV vaccines and the modern screening tests that we know today, saving lives. She never got the chance to choose this or even benefit from it. And one interesting thing that her life did is that it strengthened conversations around bioethics, maleficence, justice, beneficence, who gives consent, when and how. And those conversations are saving lives today. We have another woman who is asking a simple question. How is it that women will get to the hospital during labor and still die? Her name is Dr. Loveday Penn-Kekana. She's a health systems researcher with the WHO and the London School of Hygiene and Tropical Medicine. Now, her work in emergency obstetric care has exposed how health systems continually fail women in crisis, with transport delays, referral systems, staffing gaps, disrespect. And what she has done is that she's pushing for practical fixes so that when a woman needs a C-section, a blood transfusion, or even eclampsia management, the system delivers fast, safe, and with dignity. And one of the significant fixes is as simple as transport. Women supporting women in Nigeria. Professor Hadiza Galadanchi. Now, Professor Hadiza also happens to be the first female gynecologist in northern Nigeria. And she asked a question: how can we use low-cost innovations to prevent the number of women who we lose daily to postpartum hemorrhage? In case you didn't know, postpartum hemorrhage is a leading cause of death, in women following the childbirth. What she did was to come up with what we call the emotive approach. Now, in this emotive approach, she uses a calibrated drip to measure the amount of blood loss in women. This way, they know exactly the amount of blood she needs to be transfused. They can measure how much she has lost, how much she needs, to replenish. Oh, Barry, this very low-cost innovation has dramatically reduced the number of women